Dja Wurrung Stan Dryden knows all too well the toll that suicide takes on Aboriginal families and communities.
I've had a few members of my family pass on from making that decision to take their lives.
His wife Sophia is one of them. She died by suicide more than 20 years ago.
She made a decision to take her life, and that absolutely ruined us as a family.
Decades on, Victorian Indigenous communities are still grappling with a suicide crisis, and it's spiralled in the past year. In 2021, there was a jump of 75% in the number of suicide deaths, most young men from regional areas.
They weren't born to commit suicide. They were born to be elders one day.
Those working at the coalface of suicide prevention say an increase has been expected, even before the pandemic took its toll.
The unmet needs are increasing and we have an effective tsunami of unmet needs.
A recent Victorian coroner's report found the stresses that lead to suicide for Indigenous people are complex and include factors like substance abuse, unstable housing and contact with the police and justice system. But experts say most often the underlying cause is poverty.
What takes your life above the poverty line is 20, 30 and 40 times more likely to take your life below the poverty line. For First Nations people, it's even higher.
Nationally, 40% of Indigenous people fall into the bottom 20% of income distribution, and the weekly average income for Indigenous households has decreased 4.5% since 2015. Over that same period, suicide rates for Indigenous Australians have increased, with 1 in 17 deaths now identified as suicide. It's hoped the treaty process could provide some solutions.
It will allow us to make our own decisions about our own culture and our people, and we will have the final say.
Until then, grassroots Indigenous-run organisations say early intervention is key. They want to see more investment in existing services already on the ground.
Strengthening on what we already have would be really great. What we're doing now is working.
The spike in Aboriginal suicide deaths comes despite a commitment from the state government to improve mental health outcomes for First Nations Victorians. That pledge was prompted by the findings of last year's landmark Mental Health Royal Commission. Many of those projects are long-term, but it's clear communities are yet to see the difference. Dana Morse, ABC News.